Hi everyone, Stephen from Clubb Dental. I promised last time that I'd talk about making crowns. Last time we talked about why you might need a crown, and today we're going to talk about the process. The first thing that we do when you come in for your crown is we get you nice and numb. You've got to be super numb, and the preparation is just like having a filling done in terms of the noise and the vibration that you might be familiar with. There's no sort of magic trick to getting around that one. Traditionally, crowns were done in two stages. You'd have a preparation stage, and then you'd have a temporary crown put on the tooth, which would be left there for about 2 weeks usually. And at the end of the 2 weeks, you'd be numbed a second time, and the temporary crown would be taken off, and the permanent crown would be put in its place with permanent cement, and you were there. And occasionally we'd find that when we took the temporary crown off and we went to put the permanent crown on, it may not fit entirely perfectly, and it may not look like a great color match, for instance, or there might have been a gap, or it may have been too big, that sort of thing. And that sort of problem occurred often in the manufacturing of the crown. Sometimes the impression was not perfect. The way that we do them now, though, we're able to, if it's an individual crown, we'll do them in a single visit, which is really good. We're able to prepare the tooth in much the same, not identical, but pretty close to the same process. And we manufacture the crown here, and then the crown is glued in, all in the same visit. So it takes about up to 2 hours to get the new crown in, but it's all done, so you don't have to come back. So I'll show you how the process works when we do what's called a CEREC crown. Okay, so you're in the dental chair, and the tooth has been prepared. So the next thing that we do is we go to this computer over here, and we grab little camera, and we use that to take a series of pictures of your teeth, and the tooth in particular that has been prepared for its crown. Using the software in here, we generate a three-dimensional virtual reality model of your prepared tooth. We're then able to use the program to superimpose a virtual crown onto the tooth, and it's that virtual crown which is turned into a real crown, which will then be cemented onto your tooth after it's gone through the milling process, which happens over here. So this is the mill just here, and what we do is we take a little ceramic block, and that will be turned into your tooth, into your crown, and that goes into the mill there, and the little cutters go back and forth shaping the tooth, and once it's the exact copy of what we've designed in the computer, we then try it in back in the room, and assuming that it fits well, it then goes into the oven. And so this is the oven here. You can see that one there. And what we do is we take our prepared crown, and then we put it on a special tray, which then goes into the oven. And I can't put my hand in there because that's 500 odd degrees Celsius right now. It takes the crown up to 850 degrees Celsius and holds it there for 3 minutes, and then slowly cools it down. And when it comes back out of the oven, it's reached its final color and has its strength, which is what we're after. So that next and final step is back in here, where we take the crown, and we use a really high-tech bonding agent, bonding glue to fit it to your tooth. It's cleaned up and polished, and you're ready to go. And the tooth is ready to be chewed on straight away. You're still numb usually for a little while afterwards, so you do have to be a little bit wary of biting your lip or drinking something hot. But the tooth itself is ready to be used and smiled with and flossed and all the other good stuff. And if you have any questions, put them in the comments down below. And if you like the video, please hit like. And yeah, I hope this has been helpful. We'll see you later. Bye.